Hi, my name is Peggy Stanton. I'm a nurse at Thomasville Medical Center on the Geriatric Behavioral Health Unit. I graduated from Davidson County Community College in 1992. Immediately after graduation, I worked in the labor delivery newborn nursery area of the local hospital, and I did that for a short period of time before starting having my own children, and I started doing PRN work for self-employment PRN work for doctor's offices. I did that for several years, and then I took off about 8 years from nursing to homeschool my children, and I returned to nursing about 5 years ago. I currently am the clinical unit leader on night shift at Thomasville Medical Center on the Geriatric Behavioral Health Unit. Although I've been a nurse for many years, I've not given much thought to the pharmacodynamics, pharmacogenetics, and pharmacokinetics of medications. After reading the assignments in Nursing 482 this week, I'm very fascinated specifically with pharmacokinetics and the actions of medications. I currently work on a large 45-bed geriatric behavioral health unit. I don't have a specific case study to which I'll be referring. However, I've often observed negative effects of antipsychotic medications on many patients. These negative effects manifest in a decline in the general health of the patient or have an oversedating effect on the patient. I've heard other nurses make statements such as, all the medication just caught up to them, in an explanation of why they're oversedated. I've wondered about the validity of that statement. I've also wondered that if it is a true statement, why is it so? After reading the chapter about pharmacokinetics, I believe I have a better understanding about why geriatric patients sometimes experience a general decline in physical health or the effect of being oversedated while being treated with antipsychotics. Pharmacokinetics refers to the movement of drugs in the body, specifically how the body handles drugs. Many intricate processes are involved in how drugs move in the body, but these processes can be categorized as absorption, distribution, metabolism, and excretion. Mental health disorders are common in the elderly, but the elderly are much more likely than younger adults to experience adverse effects from the psychotropic medications used to treat the mental health disorders. Although there are educational and administrative attempts to reduce the use of antipsychotics or psychotropics in the elderly, use such as the U.S. Omnibus Budget Reconciliation Act of 1987, it remains an essential and successful treatment modality for some. A better understanding of pharmacokinetics is essential in all patient populations, but it is especially important in the elderly. With a better understanding of pharmacokinetics, I should be able to better anticipate potential complications and hopefully avoid some of these complications in the patients that I serve. Although all categories of pharmacokinetics are altered in the elderly, quite possibly the most important factor is the alteration in absorption. And in the elderly, there is an increase in gastric pH, which results in increased absorption of basic drugs and a reduced absorption of acid drugs. There is also a reduction in the motility of the GI tract, affecting absorption. The percentage of adipose or fat in the body increases with aging, causing a reduction in the total volume of water in the body. This causes water-soluble drugs to have less distribution in the body, and lipid-soluble drugs such as Haldol, Valium, amitriptyline, and Thorazine, just to name a few, have a greater distribution in the elderly. It is a stressful situation for anyone to be hospitalized. However, it's much more pronounced in the elderly. During hospitalization, some patients experience an alteration in nutrition related to the acute stress. This further compromises the absorption of drugs. If adipose tissue begins to break down in the body, this can cause an increase in bioavailability of antipsychotics in the elderly. the blood-brain barrier is comprised of a dense lipid-soluble membrane. Multiple lipid-soluble antipsychotics can set up a dangerous situation for a patient who's already compromised in many areas. As I've said, having a greater understanding of pharmacokinetics will make me more aware of potential complications. I will be more vigilant in monitoring for subtle changes in my patients that may have gone unnoticed before. I will be more studious of lab results that indicate renal function, hepatic function, cardiac function, and general nutritional status. I feel this knowledge will allow me to have a greater impact as a member of the nursing medical team, allowing me to be a better patient advocate. I look forward to this course and forward to working with all of you. Thank you.